Hey there, welcome to This Explainer. Today, we're diving into a truly groundbreaking study on compassionate psilocybin therapy. So, what actually happens when terminal patients are legally granted magic mushrooms? Let's find out. Canada absolutely paved the way here, from early exemptions in 2020 to a special access program by 2022.
But look, this is real-world compassionate care, meaning it happens completely outside of highly controlled, strict clinical trials.
This specific study tracked exactly 8 Canadian cancer patients, all dealing with incredibly tough end-of-life distress. Okay, let's look at the setup. It's a super straightforward timeline, tracking folks from baseline to the endpoint. After those high doses, side effects hit fast. We're talking mostly nausea, crying, and some pretty intense headaches. And this brilliantly illustrates a wild paradox. The sessions were incredibly meaningful, but also hugely psychologically challenging. For some, it was literally the single most difficult, challenging experience of their entire lives. No joke. Yet, 2 weeks later, massive drops in anxiety, depression, and pain, plus a huge boost in spiritual well-being.
Now, what's really interesting here is how the data totally backs up those massive symptom improvements.
Look at this. Even with that incredible relief, their views on medical assistance in dying didn't change at all. So let's pivot for a second. How did their pre-treatment expectations actually stack up against reality? As you can see, for almost everyone, those really high hopes for relief, they were genuinely met. But here is the crucial catch. One single patient actually reported a huge drop in their overall well-being. That outlier proves the very real risks of unregulated settings, lacking standard protocols and strict inclusion rules.
Plus, relying mostly on out-of-pocket cash or pro bono therapists, it's a huge financial burden that simply doesn't scale.
Bottom line, the benefits are real, but those tough experiences mean we desperately need standardized oversight right now. So, as legal access expands globally, how do we make this care scalable, standardized, and most importantly, safe?